Okay, well, we'll get things started. My name's Jordan Swain Fox. I'm the outreach coordinator for the Center for Urban and Regional Analysis, or CURA, at The Ohio State University. And today we're holding our third webinar in the series, Maps from the Past, the impact of historical urban maps on the past and present. So thank you all for joining us. This series is co-sponsored by CURA and also the University Library's Research Commons. And we're hearing from presenters engaged in research with historical maps to illuminate the links between urban challenges and impacts old and new. Today's guest, Helen Meier, will discuss the application of HOLC redlining maps in population health research and new efforts to characterize historic environmental hazards using the Sanborn Fire Insurance maps. Before we kick things off and introduce Helen, just want to mention a few logistical items today. If you require closed captioning during the presentation, you'll find a box at the bottom of the screen labeled with CC. You can click this box and select Show Subtitles to view subtitles throughout the presentation. During the webinar, you can submit questions at any time using the Q&A box, and we'll get to those questions during the last portion of the presentation. So please submit those as we go. You'll notice that chat's been disabled, so you can use that Q&A box if you have any information to share with the organizers. As you may have seen on our website, this event is approved for 1 AICP CM credit. And to claim your CM credits, you can log into your My APA account on the APA website and enter this event's info into your online CM event log. There'll be a brief survey that'll pop up at the end of the webinar in your web browser. And if you have the time, really encourage you to provide your feedback to help us improve these events moving forward. If you have any questions about the credit, about the survey, anything at all following the event, you can email me at swaim-fox.1@osu.edu and encourage you to learn more about CURA's future events, or you can sign up for our monthly newsletter by going to cura.osu.edu. You can also like CURA on Facebook and follow us on X, Instagram, and LinkedIn. And you can learn more about the Research Commons as well at their website, library.osu.edu/researchcommons. And with that, I'll pass it over to CURA's director, Harvey Miller, to introduce our speaker for the day.
Okay, great. Thank you, Jordan, and welcome everyone to the latest webinar in our series, Maps from the Past. And I'm very pleased today to introduce Dr. Helen Meier. Helen C.S. Meier is an assistant research scientist at the University of Michigan's Institute for Social Research. She examines the structural, social, and environmental determinants of health and health inequalities across the life course. Her overall goal is to understand how social vulnerabilities become biological vulnerabilities, resulting in health disparities, a really important and crucial topic. She has a bachelor's with distinction in human biology from the University of Virginia, an MPH from the University of Michigan, and a PhD in epidemiological sciences at the University of Michigan, where she now researches and teaches. She's also a native of Cleveland, like Jordan and I. So always happy to welcome a fellow Clevelander to our webinar. With that, Dr. Meier, you have the stage.
Fantastic. Let me get my screen share going. All right. So yeah, thank you so much. I'm really excited to be here to talk about how we use historic maps in studies of structural racism in population health. Just kind of building on that really wonderful introduction, I'm an epidemiologist, as you've probably figured out. And so broadly, again, I'm trying to understand how social vulnerabilities become biological vulnerabilities, resulting in health inequities. And to do this, I use a biosocial approach. And a biosocial approach considers the bidirectional interactions between social factors and biological processes acting over the life course to influence health. And more recently, I've expanded into contextual factors and their role in accessing resources that help individuals avoid disease and their negative consequences. And so this is really where the use of historic maps has come into play in my research. So today I'll go over a little bit about epidemiology and how we think about the distribution of health indicators. And I'm going to do this just recognizing that we probably have a very interdisciplinary audience, so you know where I'm coming from. And then we'll talk a little bit about historic redlining maps and how their digitization has spawned a whole new area of structural racism and health research. And then I'll end with some new work we're doing on the Sanborn Fire Insurance maps to understand historic environmental hazards. And just as a disclaimer before I launch into my research presentation is that I started this work while I was an assistant professor of epidemiology at the University of Wisconsin-Milwaukee. And so a lot of my examples use the city of Milwaukee. And I just want to say I am by no means picking on Milwaukee. It's just a city that I lived in and know well and started this work at. So a lot of our examples originate from there. So epidemiology is basically the scientific cornerstone of public health. And while most people before the pandemic thought we studied skin, we actually studied the distribution and determinants of health-related states or events in specified populations. And in particular, we use descriptive epidemiology to measure, monitor, and evaluate the health of a population. And so I'm sure as many of you encountered during the COVID-19 pandemic, we often characterize the distribution of disease or of risk factors for a given outcome in terms of person, place, and time. And since we're interested in a discussion today on place-based factors in health, here's an example of the spatial distribution of the prevalence of obesity in Milwaukee, Wisconsin, among adults from 2016. And so in trying to understand the determinants of obesity better, we can also look at the spatial distribution of risk factors for obesity. So here's the percent of families living in poverty, as well as the percent of non-white residents. And we can see stark spatial patterning and correlation of the characteristics of census tracts and these health outcomes. And so when considering these correlations, we know that where people live is not random. We know that the distribution of social and economic resources is not random either. So to better understand the current distribution of social and economic resources and health indicators, we can look upstream to historic governmental or institutional policies that impacted the race, ethnic, and social characteristics of neighborhoods, and as a consequence, health inequalities. And we can use historic maps to help us. So racial residential segregation in the United States is intensifying, and I have an example here on the left-hand side of the stark segregation in Milwaukee. The green dots are the African-American residents, the blue dots are the Caucasian residents, the orange dots are Hispanic residents, and the kind of burnt orange reddish ones are the Asian residents. And we know that segregated communities of color have higher neighborhood poverty, have lower household incomes and home values, and lower home ownership. And when we step back and ask, how did our cities get this way? The stark residential segregation in US cities we see is by design. And we have four hypothesized historic pillars that have driven residential segregation. And those include restrictive covenants or the deed restrictions requiring sales of property to whites. We have steering practices by realtors to only show properties in segregated areas. We have social pressure and violence, so community pressure and mob harassment and violence against Black families purchasing property. And then we have redlining. So I'm sure redlining is not a new topic to this group, but just to give us a common background, redlining is a term that describes the discriminatory practices of denying minority populations access to equal loan and housing opportunities. And when we talk about redlining, we're usually talking about homeowners loan or HOLC redlining. So HOLC was a federal agency created under the New Deal in the 1930s in response to the Great Depression. And between 1935 and 1940, HOLC created residential security maps of over 200 major US cities to inform local real estate on mortgage security and strengthen the loan industry. The hierarchical risk categories ranged from green, indicating best perceived area investment, to blue, to yellow, and then red, indicating hazardous perceived area for investment. So based on instructions from the HOLC, the assessors who created these maps systematically outlined residences and rated neighborhoods based on the aesthetics and age of houses, their proximity to recreational facilities and environmental hazards, and the characteristics of the people who lived in each neighborhood. The races, national origins, ethnicities, and religions of the people occupying neighborhoods were part of HOLC's assessment of an area's worthiness for investment. And the resulting grading system categorized neighborhoods on maps reflecting the prejudices of the evaluators and the ingrained biases of the system as a whole. So this racism that informed grading assessments was explicit. The descriptions of the red zones or red line neighborhoods were commonly characterized as undesirable or low-grade populations, including Black, immigrant, and Jewish residents. And so we say that HOLC residential security maps standardized racially based appraisal methods and pioneered the institutional logic of residential redlining. And we can see this logic continue in language from subsequent Federal Housing Administration underwriting manuals. So here I've just highlighted an excerpt. The evaluator should investigate areas surrounding the location to determine whether or not incompatible racial and social groups are present, to the end that an intelligent prediction may be made regarding the possibility or probability of the location being invaded by such groups. So we have some social contagion language going on in the descriptions as well. If a neighborhood is to retain stability, it is necessary that property shall continue to be occupied by the same social and racial classes. A change in social or racial occupancy generally leads to instability and a reduction in values. So you can see once this racism was institutionalized, redlining then came a self-fulfilling racial residential segregation prophecy. Okay, so you may be wondering, great, we've got this, racist policy, it's institutionalized. Well, how might it be connected to health? So health inequities are differences in the opportunities people have to achieve optimal health, and it leads to unfair differences in health outcomes. And these differences are systemic, avoidable, and unjust. So as an epidemiologist, I pull a lot from fundamental cause theory, pioneered by Link and Phelan. So a fundamental cause involves access to resources that help individuals avoid disease and their negative consequences through many different mechanisms. And what I like about fundamental cause theory is it really helps us move to contextualize risk factors. So we're contextualizing how people become exposed to individual-based risk factors. We're kind of, again, moving upstream. So racism is a fundamental cause of health inequalities. And systemic racism influences the flexible resources and socioeconomic status through many replaceable mechanisms. And these factors go on to generate racial health differences through many replaceable mechanisms. Some of these mechanisms often cited include racial capitalism, which is the exploitation of social and economic value from marginalized groups. I tend to think about the othering of people in place to enact and reinforce racial boundaries and racial hierarchy. But this is all in service of power maintenance. So we can take fundamental cause theory and we can apply it to redlining and systemic racism. So I really like this conceptual model by Swope and colleagues, and that shows us some of the mechanisms by which structural racism, acting through redlining policies and practices, influences racial differences in flexible resources and socioeconomic resources, which in turn operate by multiple mechanisms to influence present-day health. So let's go through an example pathway. So redlining influenced racialized perception of neighborhood value and practices that have perpetuated racial inequities in lending. And this led to disinvestment in redline neighborhoods. Disinvested neighborhoods had lower home values, less tax revenue to fund schools and services. And this could result in poor education and reduced access to resources for residents, all of which are factors that we know impact neighborhood health. And data from a recent study has shown exactly this. Redlined areas have higher poverty and below adequate school district funding per person compared to areas graded best, which have the lowest poverty and above adequate school district funding per person. And this is just an example that I pulled from Baker and colleagues' paper, and the specific example is in Birmingham, Alabama. Okay, so we wanna further use these redlining maps and operationalize them for use in population health research. So we want to formally study redlining as this upstream determinant of present-day health. The neighborhoods in HOLC maps were based on boundaries established by the HOLC examiners themselves. And these do not align with modern US Census Tract boundaries, for which many sources of neighborhood data in the United States are available. So we have a spatial mismatch. So my solution was to use ArcGIS to create redlining scores for modern census tract boundaries. And I'll walk you through how I did this. So with the publication of Mapping Inequality by Robert Nelson and colleagues at the University of Richmond, we have the geo-referenced redlining shapefiles for each city. So here is a redlining shapefile for the city of Detroit with the 2010 census tracts overlaid. So to measure historic redlining, we calculated a historic redlining score to assess the degree of redlining a census tract was subjected to. So again, we first overlaid census tracts onto the HOLC shapefile. We then calculated the percentage of land area and excluded tracts that had less than 20% of the land area graded. We then computed the total area of HOLC grades within each census tract, and then calculated the proportion among that total graded area that was either A, B, C, or D. These proportions for each grade were multiplied by a weighting factor. So for A or best, we multiplied by 1, and for D or hazardous, we multiplied by 4. And the weighted proportions within a census tract were summed to generate a scalar historic redlining indicator for each census tract, with values closer to 1 represent low redlining, and values closer to 4 are high redlining. In some of the work I'm going to show you subsequently, there's also a category 5. Those for research purposes are the ungraded areas within metro areas, just so you know coming down the line what that is. And so we generated these historic redlining indicators for 150 cities, over 150 cities that were included in the Mapping Inequality project. So for those of you who may be more visual like me, here's just an example of how the calculation would go. So if 50% of a census tract was graded A and 50% was graded B, the calculation for the historic redlining score would be 1 times 0.5 plus 2 times 0.5, giving that census tract a historic redlining score of 1.5. So here you can see for Detroit that initial map that I showed on the left-hand side, and then the distribution of our historic redlining indicator score on the right-hand side. And you can see they correlate very well. And so we believe in democratizing data and making sure that it's not only available to academics, but also nonprofits and other community organizations for which they might be interested in using this data for their purposes. And so we've calculated historic redlining indicators for 2000 census tract boundaries, 2010 census tract boundaries, as well as 2020 census tract boundaries, and we've made it all publicly available. So if you navigate to this website or go to Open ICPSR and search for historic redlining, this will come up, and it's all publicly available for download for free. Okay, so we've talked about the maps, we've talked about how we might measure redlining. So let's talk about some of the application of thinking about the research of redlining and health indicators. So I can't stress enough that the digitization of the HOLC maps by Mapping Inequality and then the subsequent discovery of this map by health researchers has led to a boom in redlining and health research. We're only partially way through 2024, but we're almost at the number of publications for 2023. So we're just marching right along. So my first study was conducted locally in Milwaukee, Wisconsin, and we found that historic redlining was associated with higher prevalence of both poor physical and mental health. And then when we moved this out in partnership with the National Community Reinvestment Coalition, or NCRC, NCRC is an economic justice nonprofit based in Washington, D.C. So working with them, we did a national study, and we saw similar trends in other cities as well as nationally. So we saw that HOLC redlining was associated with present day high minority, high poverty neighborhoods with shorter average life expectancy, higher neighborhood prevalence of chronic diseases, and worse physical and mental health. And some of the specific differences between the best and worst graded tracts were really stark. So the one that in particular sticks out to me is the 10-year average life expectancy difference between best and worst graded areas. That's just an incredible difference in lifespan. So we've also looked at redlining and CDC's social vulnerability index, and this is results from Milwaukee. CDC's social vulnerability index is a measure of demographic and socioeconomic vulnerability to natural or human-caused disasters or disease outbreaks. And so visually on the left, you can see the correlation between redlining and SVI. And we also looked quantitatively and found that areas not subjected to redlining policies or that had the best grade had lower SVI than other areas in Milwaukee. And with Rob Nelson at Richmond, we've developed visualizations of historic redlining, the area descriptions, and current neighborhood sociodemographic and health conditions, as well as the CDC's Social Vulnerability Index. So again, if you navigate to this website that I have in the upper right-hand corner, you'll land on a page that gives you some description of the methodology, and then below it is a list of all the cities for which we've created these visualizations. So if you navigate to a specific city, again, I have Milwaukee up here. On the left-hand side, you'll see the HOLC map. On the right-hand side is the distribution of CDC's Social Vulnerability Index. And in the middle, you can kind of see the different spatial through lines of some neighborhoods remaining, well, some declining, some improving, and some remaining poor off. And then if you click on a specific census tract or area, we've got on the top middle there is the actual HOLC area description. And then on the bottom part has, again, the distribution of social vulnerability index and where that specific census tract falls within that distribution. And we have that for demographics as well as health conditions if you scroll down. So it's a really awesome data visualization and resource, and I encourage you to check it out. So we're making connections between redlining and present-day health, but a major gap in research is understanding the mechanisms and the processes linking historic redlining to health. Some examples of these mechanisms include pollution, physical environment, racialized displacement and segregation, and modern discriminatory lending. So I'm just going to show you a couple of examples of research that we're doing looking at redlining and both access to healthcare and discriminatory lending. So present-day health is influenced by place-based exposures to environmental factors, as well as access to health promoting factors. So an aim of our research is to better understand associations between redlining and place-based measures of current exposure and access. So nationally, when we look at healthcare access, we see lower prevalence of physicians, mental health physicians, and mental health practitioners in redlined areas. And conversely, we see a higher prevalence of no health insurance in redlined areas. And again, just to kind of point out, the interval 4 is the high redlined, 5 is that ungraded, and 1 is low redlining. And then when we expand this out to look at dental care, we see similar trends where there's less dentists per 1,000 population in formerly redlined areas. Less people have visited a dentist in the prior year. And as a result, the prevalence of no teeth for individuals over age 65 is much higher in formerly redlined areas. We've also previously shown that historic redlining is associated with current lending discrimination. And so this was in our paper from Milwaukee. We measured current lending discrimination by either low lending occurrence, which it represents a lack of access to capital, or predatory lending from using data from the Home Mortgage Disclosure Act. This work, again, we're seeing that redlining is associated with current lending occurrence, but it was limited by only looking in one city and in 1 year. So subsequently, again, with my collaborators at NCRC, we've leveraged data from the Home Mortgage Disclosure Act, or HMDA, nationally from the 1980s to 2020 to understand if mortgage originations varied by census tract historic redlining status. And we observe a monotonic relationship between the proportion of originations and HOLC grades, such that formerly redlined areas have the lowest number of originations per housing unit. So there's much more lending, modern lending occurring in HOLC green or best graded tracts. And that trend is really consistent over the last 40 years. Again, we love data visualization. And so we have this tool, mapping tool. It's hosted on NCRC's website. And it allows us to visualize the racial disparities in lending, both spatially and temporally. So the dot size corresponds to the number of originations. The purple shade corresponds to the percentage of minoritized population. So a darker shade is a higher proportion of minoritized population. And then it might be a little hard to see on your screen, but we also have the HOLC grades outlined. And so if you navigate to this website, again, we have this for the entire country, pick a city, zoom in, and you can actually animate it so you can see the lending changes and shifts spatially and temporally over time. So Milwaukee, as we've talked about, is a very segregated city. And you can see very clearly that formerly redlined areas are now majority Black residents and have very little lending occurring relative to the surrounding suburbs. So everything I've shown you so far has been at the neighborhood level. But another gap in research is understanding if living in formerly redlined areas is associated with individual level outcomes. And since we saw such stark associations with redlining and life expectancy at the neighborhood level, a natural next step is to determine if historic redlining is associated with individual level mortality. So to do this, we linked redlining scores to health and retirement study. The health and retirement study is a nationally representative study of older adults age 51 and older. When we did this, we saw that participants living in formerly redlined tracts had almost 2.5 times higher odds of 4-year mortality than participants living in formerly green graded areas. And while we know that redlining itself is important, research out there, particularly by Mahasan Muhajid in the multi-ethnic study of atherosclerosis, showed that living in formerly redlined areas only really mattered for Black participants. And so I also looked at this with the kind of intersectional categories of both race, ethnicity, and redlining status. And so we see that Black participants living in high redlined areas have about 1.8 times higher odds of 4-year mortality than non-Hispanic white participants living in low redlined areas. And a natural criticism of this as well, maybe we shouldn't compare Black participants to white participants. Maybe we want to look only among Black participants. And so when I further did that, so I compared Black participants in high redlined areas versus Black participants in not graded areas, you still see about the same effect estimate. It was like 1.85 odds ratio. So pretty consistent elevated odds of higher 4-year mortality. All right. So all of this research I showed so far and much else by other colleagues out there was all spurred on by the digitization of these historic HOLC maps. The other areas that I see redlining research going into are considering other housing policies and practices like urban renewal. So if you're interested in urban renewal, which allowed for the redevelopment of areas and cities that were deemed to be blighted, and that occurred in the 50s and 60s, I encourage you to navigate to Renewing Inequality. It's another project by Rob Nelson at the University of Richmond. If you just Google it, you'll land on it. And he's got great information there. We're also, again, interested in understanding more detailed modern discriminatory lending. We're interested in understanding neighborhood change over time, as well as individual level moderators, such as like coping behaviors. And then we really want to leverage longitudinal studies like HRS for multi-level analyses, as well as investigating the life course timing of redlining exposure. So in life course epidemiology, we think that maybe it's the accumulation of living in a formerly redlined area that might matter, Or maybe because we know it affects education, maybe it's just during a sensitive period, maybe during early elementary education, right? So we can look at where participants live during different periods of their life course, and if that fell in a historically redlined area, and if that matters, we can test accumulation theory as well as, again, these critical or sensitive periods. And then we're also going to talk about environmental hazards using the Sanborn maps, and I'll get to that in a minute. So I just kind of want to pause and reemphasize that our results reinforce the impact that that policy has on place, and all of that has on health. So, for example, the decision by assessors to redline neighborhoods in Milwaukee was overwhelmingly anti-immigrant and anti-Semitic racism. And we know this from the HOLC assessor remarks. And that's in contrast to other cities like Richmond, where clearly it was anti-Black racism. Milwaukee's Black population largely arrived in the second Great Migration, which occurred after the HOLC maps were made. So on the left-hand side, again, we have our Milwaukee map, and I just pulled a HOLC area assessor remark. 25 years ago, this was a good middle-class section of Milwaukee occupied by the second generation of Germans. Jews began to move in 20 years ago. And on the right-hand side, I have our modern map. In that same neighborhood, you can see the mortgage originations over time pulled from our NCRC lending discrimination mapping tool. And then below it, I've listed the neighborhood health characteristics from 2017. So it was a 95% Black neighborhood, 43% poverty, 14% asthma, 41% had high blood pressure, and 44% had obesity, and 19% had mental health problems. So again, just the legacy of some of these redlining decisions and what that proxies for have racialized space and impacted trajectories of neighborhood. And and that has resulted in the health of residents who were not even born when these determinations were made. So it just really shows the importance of the contribution of not only historic maps, but understanding their context, specifically sometimes city-specific context, how important that can be for population health research. So the intentional, explicit, and implicit racialization of physical space to enact and reinforce racial boundaries and racial hierarchy has occurred over centuries. And I love this figure because it shows the chronology of major race ethnic segregation strategies, laws, and Supreme Court decisions over time. And when we think about structural racism, this really reinforces that redlining is only one piece of a very big puzzle. However, it is a piece for which we have a really good remaining historical record. But again, we still don't have data for many other important historical processes like racial covenants and blockbusting. So when I talk about redlining, I really want to reinforce that it's not in necessarily a causal sense, but more in that redlining is proxying along a lot of these ongoing historical processes. Okay, so HOLC maps are not the only historic source of information about cities. And HOLC maps have limitations. So they're limited to urban residential areas for cities that were 40,000 people or more in the 1930s and 40s. And so a goal of our current research is to use other historic data sources to fill in that missing information. So if you look at the HOLC map on the left, this is for Richmond, Virginia, you can see the different graded areas, but then you also see white areas, particularly with like these crosshatches. And that's kind of running through the city center. So those are all ungraded areas by HOLC. So we're trying to fill in that missing information. And to do this, we're using Sanborn Fire Insurance maps from the Sanborn Mapping Company. So Sanborn maps were used to assist fire insurance agents in determining the degree of hazard associated with a particular property. They go way far back. So they're from, they began in 1867. And it's just interesting reflecting on all of this, that a common theme that I've learned is that companies involved in risk estimation keep really good records. And so we want to keep leveraging their really good records for our research. And again, specifically, we're interested in understanding these areas that were not created by HOLC. These were usually non-residential areas, agricultural areas, and as we see in the center of Richmond, most likely to be industrial areas. So using Richmond, Virginia as an example, we are georeferencing Sanborn maps from around 1950. So here's an example area that is co-located next to a redlined area in Richmond. And the Sanborn map for that corresponding area can provide us parcel level data for this neighborhood. So we can then digitize relevant features in GIS and create a spatial data set. And this allows us to clearly see the co-location of important neighborhood features, like the segregated elementary school on the bottom left-hand side, as well as the fact that it was located right next to a gasometer, 2 railways, a junkyard, a dry cleaner, and a coal yard, and other ironworks and other industry. So we can take those neighborhood features, put them on the georeference map, highlight them, and then we can also overlay them onto current Google satellite imagery to kind of understand, you know, what was there in the past and what's there in the present, what stayed, what's changed. So the school is actually still there and still in use. The gasometer itself is gone, but the concrete platform that it sat on is still there. We've replaced one railroad with I-64 going through the heart of Richmond. And it looks like the junkyard is still there, as well as a railway is still there. So our current plan is to extract geolocated text from maps to identify residential, commercial, civic, and industrial sites. So this map is hot off the press. We're just in the infancy of this process. We're still working on our methodology and troubleshooting, but I wanted to include it to show you where we're going. So you can see the purple is it kind of looks hot pink on the display. Those are industrial sites as in the 1950s from the Sanborn maps, and so you can really clearly see the co-location of industry and red and yellow graded areas in Richmond versus the absence of industry in blue and green lined areas. So we're hoping as we develop this and expand it out that we can better understand these co-locations and what that might mean for environmental justice in cities. So this is the distribution of cities for which we are georeferencing Sanborn maps. We also have an effort right now to get maps for missing target cities that are not available right now in the Library of Congress from the University of Michigan Library, as well as the Big Ten Library Consortium records. So, you know, again, shout out to the librarians and the Library Research Commons. You know, love working with you. Everybody's been really helpful. And we're also collaborating with Adam Cox at oldinsurancemaps.net to georeference the Sanborn maps. And while we have a lot of students at the University of Richmond working on this project, it's a crowdsourced platform and open to collaborators. So if you feel like georeferencing is part of this, you know, volunteering some time, we're always welcome. So with that, I just wanted to take a moment and acknowledge my collaborators at NCRC, University of Richmond, and University of Michigan, and mention that a lot of the work today I presented was funded by a grant from the National Institute of Aging to look at place-based factors and health. And with that, I am happy to take your questions.
Okay, fantastic, Dr. Meier. This is an incredible project, and I appreciate all the background information you gave to our audience, so we have a firmer understanding of where this is coming from. So very well done. We already have a bunch of questions in the Q&A, and we'll get to those really quickly. I want to encourage the audience to keep asking questions and put in the Q&A, and Jordan will pick them up in just a few minutes and get to the ones we can. I have a couple questions I just want to start with. One question is, so who is the audience for this type of work? Who do you really want to speak to in doing this research?
That's a great question. I think that I operate in an interdisciplinary team, and so we always are kind of like, okay, how do we message this research for public health? How do we message this research for nonprofit and economic justice, and as well as digital historians? So I think the overall goal is to try and better understand the historic context that has produced a lot of the patterning we see in our cities and help us understand that because it's been going on for so long, that solutions are not going to be simple, right? They're going to probably be complicated, and things need to recognize any interventions. So public health, we're always like, okay, what's the intervention, right? Any intervention is going to need to be sensitive to these historic processes. So I'll give you an example. In Milwaukee, in the pandemic, they were trying to determine where to make the vaccine first available. And part of that included, because Milwaukee Public Health Department recognizes racism as a fundamental cause of health and health disparities. Part of that was making sure that some of these same neighborhoods that were formerly redlined had early access to the vaccine. But that can backfire because these are minority neighborhoods and high poverty, and they feel that they are being experimented on, right? So again, when we're trying to use this information and leverage it for interventions, I think knowing some of these historic processes, especially racism, can be really helpful in trying to think through different interventions and recognize that, again, solutions are not easy. But I've presented these things to the CDC, to clinicians, and everybody seems to be really interested in it, especially when particularly individual level interventions fail, and we need to think upstream.
You anticipated my next question, which is what are the potential solutions suggested by your research? And I'm wondering if we could drill down into that, because that's really something I think about in some of the work we've been doing with Sanborn Maps is, what are we suggesting should be done? So maybe you can give us some more details on that, or more speculation at least.
Yeah, I mean, I think if I knew the right answer and had a silver bullet, I'd win a Nobel Peace Prize, as I'm sure, or Nobel Prize, as I'm sure you would as well. It's complicated. I think everything's on the table from reparations, but knowing that that's just such a hot potato of an issue, I think advocating for things like universal basic income could be really important, where we're trying to kind of lift the bottom and make a good solid base, and then making sure that we're seeing modern lending discrimination happening in these same neighborhoods, right? So just making sure that fair housing laws that are on the books are being enforced, banks are being held to the fire, to make sure that we're not continuing to disinvest or ignore neighborhoods that have been historically ignored and disinvested.
Right. I mean, there's clear evidence that the history is not past here. The history is still present in some of these neighborhoods, and I think your research is a vivid illustration of that, and very helpful for people to understand, both practitioners, clinicians, and also just the population at large, to understand what happened in some of these neighborhoods in American cities. I'm going to turn it over to Jordan, who's going to go through some of the audience questions we already received. Jordan, take it away.
Thank you. And thanks for submitting questions, folks. You can continue adding those in, and we'll get to as many of them as possible. Starting out, there's a few questions about the HOLC maps and documentation around that. Is there a place to find original HOLC report documents for individual cities, like some of the excerpts from the presentation? So some of the written documentation alongside the maps.
Yep, so Mapping Inequality, as well as our social vulnerability, has it all imported. Yep. Great. So Mapping Inequality is the end all be all. So give them your internet hits. But we've also imported them. If you want to see that, if you go to the HOLC map on the if you go to the social vulnerability website, which I believe has been put in the chat and made available to them, to participants. If you go to a specific city, you click on a neighborhood, it would have the assessor marks on the top, which you can scroll down through, and then all the current stuff for health and sociodemographic profile on the bottom, which is also scrollable.
Great, thank you.
Yeah,
and then
fantastic resources, both of them.
Perfect. And then one other sort of related question to that about the maps: if there were more, if there was more than one map created for an individual city, how did you make a distinction about which one you would use to draw parallels between the historic redlining policy and then the modern day policy impacts.
So I didn't have to decide anything because I just pulled whatever Richmond put up. So I would refer those questions to Robert Nelson at the Digital History Lab at Digital History Scholarship Lab at University of Richmond. I think we also are relying so strongly on HOLC because other maps like FHA maps were destroyed. I think there's only maybe one remaining FHA map for Washington, D.C. A lot of those were destroyed in, I believe, the 60s or early 70s, maybe it was 68 because of a lawsuit. So again, we're kind of clinging to what we have in the historic record.
Gotcha. We have a couple questions related to gentrification in areas that were previously segregated by redlining. Kind of a proxy between these two. Have you been able to identify any key indicators speaking to modern day neighborhood transition? Has any study been able or been done to indicate trends across previously redlined neighborhoods and how they're changing in modern real estate markets?
Yeah, so again, this is not my area of expertise, but I fortunately collaborate with some really wonderful researchers at NCRC, in particular, Bruce Mitchell. And so we actually have a paper in progress right now that is looking at different methods for gentrification, comparing them, because different disciplines and even within discipline have different definitions for gentrification. And so we're kind of comparing the different ways to measure that and look at gentrification and look at some of the HOLC areas in relation to gentrified areas. Our test case is Washington, D.C., but we're looking at moving that out nationally. So again, I'm going to punt a little bit on that because kind of that's forthcoming. But in general, yes, redlining and other processes make these neighborhoods vulnerable for disinvestment, and then pulling right for redevelopment, as we would see in urban renewal or in gentrification more recently. And so again, it's part of these cyclical neighborhood histories that's really important to understand. And I think the issue with gentrification is that, at least in my view, and I could be wrong, but in my perspective, it's very city specific. And so that can make it difficult to draw national trends. And so it might be more pertinent to look at city specific development and gentrification.
Thank you for that. We have a question. Much of the science on the relationship between structural level factors and individual level health outcomes relies on using a person's home address as a proxy of their exposure to various things. What are your thoughts on the notion that people don't always work, live, worship near their home address and possibly are in a very different neighborhood? And how could that be incorporated in this research?
Yeah, fantastic question. And you're exactly right. It's complicated. Again, we might be limited on the individual level or the study level to the data that has been collected. So we usually always collect an individual's home residence in these longitudinal cohort studies, especially because we send people payment for participating, right? So we definitely have where they live. There are efforts in certain studies to also capture where people work or go to school or attend religious services. And so it is certainly a limitation of research using an individual level research to only look at where they reside. For some things, it's less of a limitation, especially when we're thinking about other socioeconomic pathways like home ownership. So like their home value is, or their lending rate or things like that is going to matter on their home address. So it just kind of depends on what exactly the research question is and what you're trying to look at. But it is certainly true that we spend a lot of time at work, and those trends have changed over time. So it might have been that I don't know, longer time ago, people were more likely to be within, live, work, play, pray within a specific neighborhood. And then we went through vast shifts in that. And, since the pandemic, like, are we back to that? Are we staying more in certain areas? We're working at our homes now. So we also have to deal with changes in temporal trends in that as well.
Thank you. Let's see. We have a question. Do you see potential connections under NEPA analyses, cumulative effects, and environmental justice, notably, in integrated place-based mitigation strategies for federally funded infrastructure projects? And if so, any specific recommended strategies?
Right, that was a big one. Can you repeat some?
Yeah, I'm sorry. So there,
That's okay. I just want to make sure I heard it correctly.
So do you see any potential connections under NEPA analyses in integrated place-based mitigation strategies for federally funded infrastructure projects specifically?
Yeah, so this is certainly not my area of expertise. There is a bunch of research out there connecting redlining and pollution, as well as thinking about redlining and infrastructure. I know in Milwaukee, we looked at redlining and the number of primary and secondary roads within a census tract, and we didn't see any associations there. That just might be a city level thing of the way Milwaukee developed. And I'm curious to know if that finding would be replicated in other places, other cities. I do know that the CDC is really interested in environmental justice, and the EPA is as well. So the EPA has their EJ screen, which is a census tract level measure of index of factors that they believe impact environmental justice. And CDC has just created recently so they have their social vulnerability index, and now they're creating an environmental vulnerability index. And I just heard some results looking at redlining and this environmental justice index from the CDC back in May. I don't know if those have been published yet or not, but I believe if you Google it, you might find again, they were going to do a whole data visualization and resource, and you could kind of, again, look at the co-location of redlining and these high environmental justice vulnerability areas. So I know that work is being done out there. I stick to more health outcomes because I'm an epidemiologist, but it's certainly a really important part and piece of this puzzle.
If I can follow up really quickly, there's something in that question I'd like to drill down into, which has to do with the cumulative impacts. And we know from environmental justice and health outcomes that cumulative impacts really matter. And yet the science on that seems to be lacking. We don't really know how different stressors and burdens actually impact health outcomes. So do you see potential in this research for understanding the impact of cumulative burdens on health outcomes?
Yeah, I do. I work with Sarah Adar over at the School of Public Health here, who's got really amazing air pollution modeling for, I believe, from 1990 to present. So again, we can think about where people have lived and their cumulative impacts to air pollution and health. I think as this field is nascent, and so as it grows, I think it's going to be really interesting to think about different methods from different disciplines, analytic methods from different disciplines, and how that can help us parse out different pieces of this. So I know in my own work, we've done some mediation analyses to understand like redlining and then pathways through current socioeconomic indicators and health, and what proportion of that would be considered a direct effect and what proportion is mediated through these more proximal socioeconomic factors at the neighborhood level. So I think that's, we can apply different methods. I think we need to be doing more spatial methods applied in this area in epidemiology. That's a major limitation of it so far. And then what else was I going to say? I mean, and then I think the other thing is that we just have to make sure that we have the data. right? And again, a lot of the work that I've been doing is trying to break down silos between different disciplines and, take this data from history and pull it into health. And so, maybe I don't know, or my colleagues don't necessarily know all the data for thinking about cumulative effects that might be out there. I know the NADA data has a lot of pollution that could be pulled in, pollution data that could be pulled in, and has that over time. Yeah, I think we've got data limitations, we've got analytic method limitations that just need time and space to percolate and work on. And if anyone has suggestions, I'm all ears.
Awesome. We have a question earlier in the conversation about other factors that can contribute to the poor quality, poor health outcomes. Is there a possibility that poor transportation and little access to utilities like groceries plays a part in the poor quality of redline areas? And how did that come up in your research?
Yeah, so again, these are kind of those, when I kind of talked about, we've got this, like that conceptual diagram, right? You've got redlining operating through housing policy, access to individual place-based resources, modern discrimination, other policies and practices, food access, food deserts, transportation are all important. I would again encourage people to, so Carolyn Swope has that wonderful conceptual figure, but it's part of a systematic review. She's done a fantastic job at looking at redlining and health outcomes, redlining and environmental outcomes, and other infrastructure as well. So I would encourage people to kind of look to the literature for that, but it's certainly, all of these things are kind of downstream of these more historic pieces, which is nice because we can kind of think about that temporality. Again, I would caution making redlining the causal piece. I would say it's really a proxy for racism in all of these different policies and practices, and measured and unmeasured.
Maybe you have time for one more question before we wrap things up. Participant asks, I've been reading about the importance of sex disaggregated data recently. Is this something that came up at all in your research, and any plans for that in the future?
Yeah, fantastic. So as an epidemiologist, our table 1 in a paper is usually looking at either the outcome by covariates, including sex or gender, as well as looking at the distribution of exposure by covariates. And interestingly, in all of the individual level studies we've looked at, we see no associations between redlining and gender. So yeah, it's not a factor so far.
Yep. That's research.
Now, that doesn't mean in some analyses that we know are differential. This is where you get into the methods, but we know in some analyses for some outcomes, you're going to have obvious gender differences. And so maybe you would control for it in a statistical model anyway. But if it's not associated with the exposure, theoretically, it's not a confounder of the association. And so you wouldn't need to disaggregate.
All right.
Well,
or sorry, Harvey, I was just going to say we have a number of questions that we can't get to, so I'm sorry about that. I'll put my email in the chat if you want to reach out to me, and we can try to answer some of those. I also just wanted to highlight a comment. Just want to say thanks for your careful explanation of how HOLC redlining is not always a casual determinant, but also a proxy for broader systemic and institutional racism and spatialization of inequality. So key for our understandings of historic and present inequality and for the kinds of solutions needed to address it. And I think that just sums up what I'm thinking hearing this really well. And we appreciate your time on that today.
Really, thank you very much, Dr. Meier. This was really, first of all, it's incredible research, as I said before, and this was like a masterclass for understanding why redlining and this historic data is really important to understand social and health outcomes in this present day. So, good luck with this research. I'm going to keep in the loop here and try to follow your research. And as I mentioned, we're also working with Sanborn Maps here at Ohio State, and I want to also a shout out to Alex Cox and the oldInsuranceMaps.net. We had a couple mapathons this last year that Josh Sapardi at OSU Libraries to organize for us. And we hope to do that again this year and try to get more of the Columbus Sanborn maps geo-referenced so that we could use them for research like this. So if you want to do some work in Columbus, we should talk as well. So again, thank you so much. This was really a fantastic talk. Really loved it. I want to point out a couple things. One is that our final event in the maps from the past summer series will be on August 16th from 12 to 1 p.m. Eastern Time. And that will be on the lost subways of North America with Jake Berman. Should be a very, very interesting talk on subways that were built and that were never commissioned, and also subways that basically were planned and never happened. He has a book about this, Lost Subways of North America, and he'll be talking about some of his research on that. I also just want to give you a preview. This autumn, we're going to have a new series, and it's going to be on, I'm not going to give you too much detail or tell you who the guests are, but we're working on that right now. It's going to be on housing affordability and the housing crisis in the United States. And we already have some guests lined up. I'm not going to mention their names because it's still in progress, but keep in touch with CURA at cura.osu.edu, also on whatever we're calling Twitter these days, and Instagram and other social medias. You can go to our website, again, cura.osu.edu, and sign up for our newsletter, and you'll never miss any of these really great webinars that we do here at CURA. So thank you very much, Dr. Meier. Thank you very much, audience, today, and take care. Have a nice weekend, and be safe and healthy. Thank you.